Borderline personality disorder is a mental health condition that affects the way people feel about themselves and others, making it hard to function in everyday life. It includes a pattern of unstable, intense relationships, as well as impulsiveness and an unhealthy way of seeing themselves. Symptoms include fear of abandonment, unstable relationships, intense mood swings, periods of stress and paranoia, impulsive and risky behaviors, self-injury, feelings of emptiness. There are 4 different types of BPD: petulant BPD, impulsive BPD, quiet BPD, and discouraged BPD, though all of these can at times overlap. Unlike other BPD subtypes, people with petulant BPD may display more angry mood swings and a defiant attitude. This subtype fluctuates between feelings of being unworthy or unloved and explosive anger outbursts. Key characteristics and behaviors associated with petulant BPD include negativity, sudden and severe mood swings, impulsive and uncontrollable behaviors, erratic thoughts and emotions, feelings of unworthiness, a pervasive sense of being unloved or unworthy of love. Most behaviors associated with petulant borderline personality stem from a fear of abandonment, lack of self-worth, and an inability to self-soothe. Impulsive borderline personality disorder is a distinct subtype of BPD characterized by unique features and behaviors. Often perceived as charismatic and energetic, individuals with impulsive BPD are notably engaging, setting them apart from other BPD subtypes. The defining trait of impulsive BPD is impulsivity, manifesting as rapid, unplanned actions, often driven by a preference for immediate rewards. This impulsiveness can lead to risky behaviors and personal difficulties. Alongside impulsivity, individuals with this condition may grapple with other symptoms: intense fluctuating emotions, fears of abandonment, and a shaky self-image. Individuals with impulsive BPD may engage in risky behaviors and often struggle with effective communication due to their emotional dysregulation. This can lead to a cycle of intense, unstable relationships marked by frequent conflicts and misunderstandings. Quiet borderline personality disorder is a unique manifestation of borderline personality disorder. It encapsulates many of the same symptoms as typical BPD, such as emotional instability, feelings of worthlessness, insecurity, and fear of abandonment. However, what sets quiet BPD apart lies in how individuals express these symptoms. Conversely, those with quiet BPD tend to internalize their struggles. Rather than projecting their emotions outwardly, they direct these feelings towards themselves. This internalization can manifest as self-blame, self-isolation, or even self-harm. Individuals with quiet borderline personality disorder are likely to suppress their feelings, leading others to perceive them as calm or emotionally balanced. This facade masks the tempest of emotions roiling beneath the surface. Discouraged borderline is marked by noticeable clinginess and a passive follower type of mentality. While on the outside this person might just seem indecisive or, at worst, weak-willed, they normally experience internal turmoil about their lack of leadership and bitterness toward those around them. This type of borderline disorder in a person might yield self-harm in the form of self-mutilation or even suicide. Discouraged BPD is primarily defined by a pervasive sense of discouragement, feelings of inadequacy, and a heightened sensitivity to rejection or criticism. Unlike the more familiar image of borderline personality disorder, which might include overt emotional outbursts and unpredictable behavior, individuals with discouraged BPD tend to turn their pain inward. They are more likely to experience depression, anxiety, and a deep-seated fear of being alone or abandoned, yet they may not express these emotions outwardly.